Hello everybody, my name is Dr. Hitesh Batavia from Ravenscourt Dental Practice in Hammersmith. I earlier on taped a little talk about changing habits. So talking about that further, especially in dental related terms, is about giving up sugars. Just to tell you, just to go through a little bit about sugars, some of this you may already know, but I hope it helps to reinforce the message. Having sugars on a regular basis can cause dental decay, which means you get pain and then you end up having a filling and then the tooth breaks and then you need a crown. So it goes on, and the idea ideally is prevention is best. So what we tend to advise patients is that if they've got a very sweet tooth, to try to moderate it. So there are two main things about sugars. One is the different kinds of sugars that we have. There are the natural sugars, and then there are the refined sugars. The teeth do not differentiate whether this is a natural sugar or whether it's a refined sugar. So the examples of refined sugars are chocolates, biscuits, all that kind of stuff. The natural sugars, now this is the big one, which is fruit juices, fruit juices and what are they called? Smoothies, sorry. This is what happens after 7 weeks of staying at home. Smoothies, apples, grapes, raisins, mangoes, pineapple, honey, dates. So any of these things, they are actually very, very sugary. So we must not, and even yogurts which are flavored, so it's got some sugary stuff inside it. So all those things are equally damaging and may cause difficulties. So when you want to give up sugars, you need to remember you need to moderate those as well. What I normally tell patients is that if you have a bag of raisins, say for example, if you have 1 or 2 raisins every hour, that is going to give rise to each time an acid attack which stays in your mouth for 20 minutes or longer each time. More number of attacks you have, the more likelihood you can get decay. Now this can carry on for between 2 to 4 years before we can actually see it in different circumstances. So what you want to try and do is when you have something sugary, have it all in one go. Ideally with a meal, and try to avoid all those sugary things I mentioned earlier on, and have a treat. Have a treat once or twice a week. Have what you want and as much as you want, but allow yourself that time. So say once or twice a week, after X I'll do this, and then that's fine. Okay, so it's not a question of you depriving yourself of a lovely treat. If you are doing all this, then maybe you can actually allow yourself that treat and at the same time help your dental health. So this will mean that every time you go to a dentist, you don't necessarily be not being told, you need another filling. That's very boring, and it'd be nice. As a dentist, well, I very much welcome, and I have lots of stickers to give to my patients, stickers for adult patients, or to encourage them to carry on a good habit. And it's a great thrill and excitement sometimes when we get a fantastic response to this kind of advice. So do try and do that. Use this along with what I've said earlier. Your mind should be telling your mouth, you do not need the sugars. Okay? That message 3 times a day. Be prepared. Have things you can eat instead of the sugary things and allow yourself the treat. Enjoy and change those habits.